Hi, first I want to thank you all for your interest in the last video I did about fixing knee joints. We had a great response from that, and I had some wonderful people writing to me with some questions for some more feedback about knee issues. Now, I can't answer everyone's question specifically about their own issue without seeing cases. I don't want to oversimplify things. It's obviously a very complex system, but there are some general trends that I think would be helpful for you to understand. So I'm going to do the best I can to help you understand as much as I can about how the knee functions and how we rehabilitate the knee. First question was, what do you do after an operation? So you've had a knee operation already. What do you do for that knee? Well, one thing is do whatever your surgeon and your physio are suggesting. You definitely want to get that knee moving, but you also want to be working on the hip, because the hip is really, really important. Hip strength and stability, just like I said in the last video, is super, super important to stabilizing that knee. Even if it's a new knee, you still need your hip stabilizers to work. I see it all the time. People after surgery, they come in and their hips are weak. So we stabilize the hip and they walk much, much better. So knee recovery is really dependent on hip stability. So the next question was, what do you do if you can't move the knee? Obviously try to if you can, but if you can't, not to worry, because a lot of, again, the focus is going to be on the hip. So we really want to make sure that the hip is working well. Obviously, in order for the hip to work well, your lumbar spine has to be strong and stable as well. So really the best answer there is make sure your lumbar spine is stable and that you can exercise your hip in a safe way. So that takes me on to the third question, is what are the best exercises? Obviously, there's a ton of exercises, but just a general information. One of the best ways to start is with isometrics, because you're not going to be moving the joint that much. The joint is in a relatively static position, and you're just loading those muscles. What that's going to do is it's going to basically create a greater awareness and greater ability to switch on those muscles. And very often we're going to be activating muscles that really need switching on. So in order to stabilize your hip, we really need that tensor fascia lata to be working. And some of the deep gluteal muscles as well need some activation. And I find that the isoclam, so it's ISOCLAM, is a great exercise. You find tons of it on YouTube. That's a great place to start. Just holding that posture for a minute rather than pumping through it. I recommend holding it isometrically. It's a great, great daily thing to do for your hip stability. Also, you can do things like, if your knees can manage it, you can do squats, you can do lunges. That's all great stuff, but definitely start with isoclam. So people had a lot of questions about a lot of different things. So here we talked about sciatica. Someone said, well, what about sciatica? Sciatica is very often related to this. Now, sciatica splits into two camps. We have something that's actually pressure on the nerve, and then we have what we call a sciatic distribution of pain, which is much more common. I have a video on that, and I'd encourage you just to watch that, but we're really talking about the same thing. What we have is an escape of those flexor muscles in the back of the hip that are very, very tight, or deep, deep hip muscles that are very tight around that area, and that creates an irritation that goes down the leg. Very rarely because of pressure on the nerve, but there is definitely pain down the back of the leg. If you can release that tension, then you're going to stop having pain down the back of your leg, and it can be immediate in most cases is. The meniscus. What happens with meniscus? Meniscus is between the two bones in your knee, between the femur and the tibia. You have a medial and lateral meniscus, and any sort of twisting motion or shearing motions can have negative effects on the meniscus. So if you don't have that lateral knee stability, the tensor fascia lata is going to limit that internal rotation of the knee, and it's also going to stabilize the knee against forward translation. So it's going to hold the knee back when the knee is bent, and it's also going to limit the internal rotation of the knee, both of which can have negative effects on the meniscus, particularly the medial meniscus. So tensor fascia lata strength and hip stability are absolutely paramount to protecting your meniscus. If you have a meniscus problem, focus on your hip. Lateral collateral, again, stabilized by the tensor fascia lata. Anterior cruciate, again, as I just said, it's going to the anterior cruciate is affected by anterior translation of the tibia, so the tibia slides forward. The anterior cruciate is the thing that's going to limit that end range, but really everything between neutral position and the end range should be protected by those lateral hip stabilizers, particularly tensor fascia lata again. So lateral collateral, you can protect that with tensor fascia lata activation. And anterior cruciate as well. So subpatellar problems, people have swelling underneath their patella. And that usually happens because of a constant load of the musculature that crosses the patella. Now we have the quadriceps as 4 muscles, but the general culprit is, now there can be some mechanical problems as well, but the thing that I see the most is rectus femoris tension. Rectus femoris is the one that crosses the hip joint, unlike the others. It's a compensatory muscle for other hip instabilities and knee instabilities. So if your hip or your knee are unstable, you will probably have rectus femoris tension. Rectus femoris is not meant to be contracting and not meant to be pulling pressure on the patella all the time, which if it is tight, it will be. And eventually that constant pressure on the patella against your knee is actually going to start creating some irritation, some inflammation. So most subpatellar problems, first thing we look for is tension of rectus femoris. Now, obviously every case is unique. I can't oversimplify, okay? But this is something that's important to look at. The iliotibial band. Lots of people know about the iliotibial band. They're always doing foam rollers and crazy stuff on it. The iliotibial band is very, very connected to the tensor fascia lata. If your tensor fascia lata is weak, you're going to have a tight iliotibial band. If you have a tight iliotibial band, you probably have a weak tensor fascia lata. Get the tensor fascia lata switched on, and that iliotibial band melts immediately. It sounds crazy. I don't understand the mechanism, honestly, but I see it every day. Psoas tension. Psoas is a flexor, so that works almost in opposites to some of your glutes and also to your tensor fascia lata. Tensor fascia lata is essentially bringing your leg out to the side, and psoas is bringing it in. It's a flexor muscle. It's a big, strong muscle that brings you towards fetal position. When the tensor fascia lata, which brings you away from fetal position, is weak, the psoas muscle will often be tight. Massaging the psoas can be effective, but unless you're dealing with the cause of that escape of those flexor muscles, it's just going to be tight and you're just beating yourself up. So again, isoclam, okay? Do some isoclam, do something to inhibit that psoas, and you're going to feel a lot better. Glute tension. So yes, glutes are a little bit hard to understand because you have to consider the joints and the way the muscles are attached. There's good glutes, not so good glutes, but basically around the ridge of your pelvis, the back of your pelvis, at the very, right next to your back, basically, right in there, people are always saying there's a spot of tension. And again, that's another muscle that's going to go tight. A little bit of compensation, a little bit of flexor issue. Yes, the glute's an extensor, but you have to understand how everything's wired in terms of anterior and posterior cords. Generally what will happen is you have tensor fascia lata, to keep it simple, weakness, you'll have some tension in the glutes at the back there. No, doing isoclams is not going to cause more problems in the glutes. So definitely do your isoclams. Pain at the back of the knee, as I said in the other video, you have a muscle called popliteus, which creates a rotation at the knee, which has a very good purpose to unlock the knee when the knee is straight. Because when your knee is completely straight, your hamstrings, which will create flexion of your knee, don't have any effect because they'll basically just pull the knee, just pull the leg up like this. So you have to unlock the knee in order to get the hamstrings to start to work. And that muscle at the back of the knee is called popliteus. It will often get tight, again, as a compensation for a weakness of tensor fascia lata. So you've heard here a lot of tensor fascia latas. If you don't know the muscle, type it into Google, get to know it, make it your best friend, work that thing out as much as you can, and I can promise you you'll be well on your way to resolving some knee issues. Again, this isn't a one-stop cures all. Oh, actually, sorry, there are a few other things. Foot problems, plantar fasciitis, the quadratus plantae and the deeper muscles of the foot are flexor muscles, and you also often have flexor escape when you have extensor weakness. Remember, tensor fascia lata is an extensor. If that's switched off, flexors will be tight, including the gastrocs and the soleus, muscles on the back of your calf. Shin splints, the muscles on the front, the tibialis anterior is a muscle that pulls your foot up, but more specifically when you take a step, what it does is it helps to lower your foot slowly. If it doesn't work effectively, you can't lower your foot slowly. If those muscles are tight or been inhibited, then, well, basically what ends up happening is they get inhibited because they're extensors. You end up with a lot of load over time on the Golgi tendons. They're not very well vascularized, so you can often end up with a situation where those muscles just get tight, but they're also being inhibited. So if as you keep stepping and walking, or as you're running more intensely, that sort of impact on an inhibited muscle creates more load on the Golgi tendon, and basically kind of a trauma that's going to result in some tension. So shin splints are a little bit complicated, but every case is unique. But again, it's still along the same lines of everything we've talked about. So again, if you haven't watched the last video on fixing knee problems, go ahead and watch that now, and watch some of the other videos about joint trauma and sciatica. I think you'll find those very, very helpful and insightful. And just want to thank you for tuning in. Again, this isn't one answer fits everything, but I think it's something that's very often overlooked. And when we do consider the role of the tensor fascia lata and how to stabilize the hip, and particularly how to stabilize the spine, one more quick note, the isoclams is going to help to activate your spine too. So if you have an unstable spine, it should be safe for you. Spinal strength is absolutely paramount. You can look at how chiropractors fix joints, that video, and I can explain all that. And also, so spinal strength is paramount. Everything to do with hip and knee, you really need stability. So I hope some of that's helpful to you. I hope I've answered your questions. If you have more questions, just fire them out to me. You can personal message or drop it on the YouTube page, and I'll be glad to address as much as I can. So thanks again for watching, and tune in next time.